is Hannah Avera from Ethiopia. I will be presenting on the emerging data from the chronic hepatitis B treatment program in Ethiopia, and subsequently followed by the impact of COVID-19 imposed on the viral hepatitis B detection and referral of patients to care, and as well as the lessons learned from the COVID-19 response, which can be replicated for the viral hepatitis elimination program. So this is a chronic hepatitis B treatment program. It was established in 2015, which is the first biggest cohort in the sub-Saharan Africa, as widely treatment was unavailable in the sub-Saharan Africa. This was established with the support of the Norwegian government. In this cohort, we have 1,303 patients enrolled to the project, and they do receive different services, laboratory services, as well as treatment free of charge. Patients do have regular clinical follow-ups with regular phone call reminders for regular appointments, as well as when patients are lost to follow-up. And patients do have also access to the project personnel through the project phone line whenever they have issues. So among the many published papers which came out from this chronic hepatitis B treatment program, one of the papers which assessed the initial 300 patients who had a complete laboratory investigation at the time of analysis showed majority of patients were of younger age group with median age of 30 years, and nearly 1/3 were found to have significant liver fibrosis or damage, of whom 17.2% had cirrhosis. So in another publication, we tried to see the applicability of the WHO treatment criteria in the sub-Saharan setting, comparing against the European Association for the Study of Liver Disease 2017 guidelines. So in this analysis, we found out that 15.3% were eligible using WHO criteria, and among those who meet WHO treatment criteria, 15.6% had decompensated cirrhosis, while using the gold standard criteria, 25.2% were eligible. So from this, we concluded that WHO treatment criteria was unable to detect those in need of treatment compared to the gold standard. When we see one-year result of the pilot program in Ethiopia prior to 2016, nearly part of the patients fulfilled the treatment criteria, of whom 19.5 started treatment. Among those who started therapy, 11.8% died, and among those who died, 93.3% had decompensated cirrhosis. 85% of patients had taken their medications and had shown to have excellent adherence, and 85.2% of patients had suppressed viremia at the end of the year, as it has been shown on the graph. So we conclude that treatment of chronic HEP can be successful in terms of adherence to therapy, retention to care, improvement in liver damage, as well as viral load suppression. Initial mortality was high, as many patients had advanced liver cirrhosis at presentation. Testing and early diagnosis is a key to reducing hepatitis B-related mortality. So when we see the snapshot of the temporary effect of COVID-19 in the general public outpatient flow in the Department of Internal Medicine at St. Paul's Hospital Medical College, upon the announcement of the first case of COVID in the month of March in Ethiopia, as clearly been shown in the bar graph, there is a drastic drop in the outpatient flow, and which currently seems to have started to revive. This has been the same trend has been observed in the general gastroenterology clinic outpatient visits. In this outpatient public sector programs, patients do pay for their PCR testing for both hepatitis B and hepatitis C, and they do pay out of pocket for their treatment. So similar trend has been observed, and currently the patient flow has started to pick up in the month of August. So seeing in the months of July and August, among all the GI patients who visited the clinic, nearly 50% and above were patients with hepatitis B and hepatitis C virus infection. So what are the lessons learned from the COVID-19 response in Ethiopia? Upon the declaration of WHO of the occurrence of COVID-19 pandemic worldwide, the Ethiopian government has taken many steps forward to mitigate the effect of the COVID-19 pandemic in Ethiopia. So among which includes prompt response from the government as well as policymakers with establishment of different committees and mobilization of different supports, including the WHO, and early identification of stakeholders and mobilization of finances as well as human resources with capacity building, establishment of laboratory in the central lab as well as in the regions, and intensive public awareness programs, and regular and uninterrupted information is being provided to the general public as well as to the stakeholders. So to scale up hepatitis B testing and the linkage to care, this has been clearly outlined in the Ethiopian National Viral Hepatitis Strategic Plan in 2016, which includes high-level government commitment to create access to testing, to establish a standard system for hepatitis B and hepatitis C testing as well as a referral to care, to establish mechanisms for routine testing for those who come for other reasons to the hospitals, and to avail testing technologies and commodities as per the national guideline, to build capacity at all levels to run as well as manage testing, and to establish management information testing system for testing, and to develop quality assurance systems for the laboratory technologies and as well as the implementations, and to look for options for community-based care, community-based testing programs, and also linkage to care using the existing established systems, and also to create system for those who turn to linkage, to create system for those who turn hepatitis B positive and hepatitis C positive for referral for care, and to develop guidance for those pregnant mothers who tested positive for care. In conclusion, there is a need. There is a need for early diagnosis of chronic HPV infection, as it has been demonstrated that early detection and treatment could reverse liver damage prior to the commencement of irreversible complications. In high prevalence areas, because of a large reservoir of asymptomatic infection, still screening remains the only way to identify those patients with chronic HPV. Development of locally relevant treatment criteria is needed, as has been depicted in our research that the WHO criteria would underestimate those who are in need of treatment. High-level government commitment as well as policymakers can bring about change in viral hepatitis elimination program, as it has been evident from the current COVID-19 response. Thank you.